Coming up today, a nasal spray for mental health. Hear how this treatment is helping those with severe depression when other options don't seem to work. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Right off the bat, I do need to let you know that today's topic includes discussions of suicidal thoughts and suicide attempts. So if you or someone you know is thinking about suicide, please dial 988 on your phone. It is available 24/7, and it will connect you with a mental health professional. Becky Boland has been open about her past traumas. They have led her down some pretty dark paths. But she is finding the light by reaching out for help and being willing to not only try different treatments, but to share her story and talk about a topic that so many people feel they need to keep private. And we welcome Becky back to our program this morning. And we just really, truly thank you for being here. We're so glad to have you.
Thank you for having me.
Thank you, thank you. We're also joined by Dr. Tyler Chorvestad, a psychiatrist and the director of the Comprehensive Depression Assessment and Treatment Clinic at the University of Kansas Health System. Dr. Chorvestad has been treating Becky for the past several years. Good morning to you.
Good morning.
Well, so there's something in the news that pertains to our discussion today. It is a new announcement by the VA. They are starting a study with psychedelics to help veterans with PTSD and alcohol abuse. Here is a portion of that announcement made just last week. This is the first VA-funded study for psychedelic-assisted therapy since the 1960s. Participants will receive psychotherapy sessions enhanced by MDMA, a psychedelic compound believed to increase emotional openness, reduce fear, and promote introspective during therapy. Dr. Chorvestad, are we seeing a change in attitudes towards different treatments when it comes to mental health needs? What are you seeing?
Yeah, I think largely over the last probably 20 years or so, we're seeing an increased openness to some novel therapeutic interventions. I mean, we had a little bit of a setback in August with the FDA not approving some of these psychedelic therapies. At that point, they felt that more research was needed, and so I think that's what the VA is trying to do here, is provide additional literature and support to basically see if these therapies are warranted. But yeah, there's a lot of innovation and design that's going into finding novel interventions for psychedelic therapy. As well as other novel targets, and we can kind of talk about some of those different targets. But mental health had pretty much stagnated as far as specific targets for us to use for treatment of PTSD or depression or anxiety until about the mid-2000s, late 2000s, and then from there we've kind of seen a renaissance of different types of specific targets that all have different modalities.
Well, let's take a look at the numbers this morning, because depression is a major issue, as we know, in this country. 18.5% of U.S. adults have had depression, according to the CDC. 8.3% of U.S. adults have had a major depressive episode. Depression is a leading cause of disability among people ages 15 to 44. And there are medications and therapies, but for some, their depression is considered treatment resistant. Today, we are focusing on a newer treatment called Spravato that is a nasal inhaler, and it hopes to help people with treatment-resistant depression. This is generally prescribed after patients try other medications but do not see a response. Becky has tried this. She has also tried light box therapy and shared her experience with us in the past. And Becky, since we talked with you last year, you told us that you had made a lot of progress since then and done a lot of healing really in the last 9 to 10 months. What is helping your mental health most right now?
There's several things. I would say first and foremost is my support system that I've found, and just using Spravato was kind of like the key for being able to tie everything together. I've been doing EMDR through my therapy. I've been doing a group called Regeneration. It's kind of like a 12-step program for like trauma recovery. And I still do my bright light every day in the winter time. And then I just know that overall I wouldn't be here without like the above things. It's really made a huge difference. And then goal-wise for the show, I just want to make like a difference in at least one person's life toward their mental health journey and the recovery process, and just realize that it takes a combination of multiple things to kind of make that happen.
Well, Becky, we are just getting the show started. You are already helping for sure, just by being here and sitting with us. But why did you a lot of people might try one or two different options and maybe give up. That seems like that might be something people would do. But you've continued to try different things. Why was that so important for you to keep going and keep trying until you found something that really worked for you?
It was important because you just have to have the hope and being able to live your best life possible. And when I was trying and wasn't succeeding on the treatments I was on, I just knew that there was something better out there and that something would eventually work.
So Dr. Jorvestad, what is Spravato and why was Becky a really good candidate to try this?
Yeah, so Spravato is esketamine. People may be familiar with the drug called ketamine. This is just one half of that drug. And Spravato was the first formulation of ketamine that was actually approved for major depression. That happened in 2018, 2019, thereabouts. And as you guys have alluded to, it's an intranasal spray. So it kind of has a novel delivery mechanism as opposed to the ketamine that we see out in the community, which can be used mainly intravenously. There are some pills or some other formulations. There are some private companies out there that also do oral dissolvable formulations of ketamine. But it's a dissociative anesthetic. It's been around since the 70s. It first got its use for depression in the early 2000s. And then over the course of about 15 years or so, there were additional trials that were done, and eventually the FDA felt that it was beneficial for patients that had not responded to standard of care treatment with typical antidepressants, whether it was SSRIs or SNRIs or atypical antipsychotics or lithium or other medications. And so for most patients, they need to have tried and failed at least two, sometimes more depending on insurance requirements, antidepressants. And usually that's in an adequate dose and an adequate duration. So typically, 4, 6, 8 weeks on each dose. And so that's about 30% of all patients with depression kind of fall into this treatment-resistant group. And usually their success rate with another medication switch at that point is going to be about 5 to 15%, depending on which medication or how many they've tried in the past. And so Spravato offers, 45 to 50% chance of going into remission, or about a 75% chance of having a 50% reduction in depression. So just from a quality of life standpoint, there's about a 75% chance or so that we can at least get you feeling 50% better than you were prior to starting that therapy.
And patients come here to have it administered. What are those treatment sessions like?
Yeah, so because it's a dissociative anesthetic, it has some sedative qualities, and so that requires us to keep the patients in the office for up to 2 hours for monitoring, and that's an FDA requirement. And so the patients come in, and as you can see here in our office, we treat up to 6 patients at a time. They have individual kind of bays that they're positioned in. There's no talking or group therapy with this. Everybody takes their dose of ketamine at the same time, and then we keep them all on a 2-hour clock. We're monitoring them for distress, whether that's anxiety, nausea symptoms. We're also monitoring their blood pressure and pulse oximetry, which is how much oxygen is in their blood while they're here. There's always somebody in the room with you. It's usually the physician or provider for the first hour or so, and then the nursing staff comes in that second hour. That's mainly due to the fact that the drug peaks around 40 to 60 minutes. And so we always want a physician nearby in case something happens during that first hour. And then the second hour is usually just a gradual come down from the effects of the drug. And so the nursing staff is more capable of handling those interventions at that point. Typically, treatment is weekly for most patients who are on maintenance therapy, and then during the loading phase, some patients go twice weekly for the first month.
Becky, how many sessions have you done? Tell us what they're like.
So far, I've done 39 sessions. I'm on once weekly treatments, and it's made a huge difference with depression, anxiety, and suicidal ideation. Going into it, I was having quite a few suicidal thoughts, which I know we'll talk about later, but it went to where they were completely gone within like 4 sessions. So when I go into a treatment, I just try and really focus on positive things and try and get like positive affirmations and thoughts going. But my brain just processes what it wants to, which is just really fantastic and hard to explain. But it's just been really awesome. I usually don't have hardly any side effects, and I've been asked a lot if I feel like high from the treatments, which usually I don't at all, and if I do, it's like very short-lived.
And what about this roller coaster experience?
So I had a couple of sessions where it kind of felt like an out-of-body experience, and it's hard to explain, but it was basically like I was on a roller coaster and just kind of going by and like seeing different memories of my life, like on a movie screen type thing off to the side. And it wasn't distressing. It was both positive and negative, so it was just kind of cool to process all of that.
Just as you're telling that story, I was trying to imagine what that might feel like, some type of peaceful feeling.
Yeah, it was pretty peaceful and just nice to, like, my brain just did what it wanted to, and I just kind of kept it in the background and
really leaned into it. Dr. Turbestad, are there side effects to Spravato? Becky said she didn't really have any, but can there be?
Yeah, I mean, it is an anesthetic drug, and so sedation is usually the most common side effect. About 60% of patients experience some form of sedation. Typically, that goes away over time. So the downstream psychological effects, those tend to persist over time, but the acute effects of the drug, as Becky was saying, most people get used to those after about the first month of treatment. The other major side effect to talk about is dissociation, as Becky was talking about there, that kind of out-of-body or disconnected feeling. Some people experience like floating sensations, or they feel like their body is kind of floating above them in the room and they're disconnected from it. That's about 40% of patients experience that. It's not something that they experience every time, and typically it's more early in treatment. Again, that's kind of one of the major effects of the drug that you get used to over time. Other things like anxiety, nausea, those are pretty common as well, and we keep medications on hand here in the clinic to manage those if that happens during treatment.
Doc, people often use the word depression kind of loosely, but can you explain major depressive disorder? It's called MDD. How can this be such a challenge to treat? Why is that?
Yeah, so regular depression, it's normal, and we talk a lot about this in psychiatry. What is a normative response to a stressful circumstance versus kind of a pathologic response to a stressful circumstance? So it's typical for everybody in their life to experience some form of sadness or depression. What differentiates that from major depressive disorder is the persistence and severity of those symptoms, also the number of symptoms. So people with kind of run-of-the-mill depression may feel down or gloomy for maybe a week, possibly a little longer than that, but they may not have any other functional impairments. So their sleep might not change, their appetite might not change, their energy or concentration may not be impacted, they may have no suicidal thoughts or anything. With major depressive disorder, all of those components are in some way involved, and so we see functional impairment. The patients aren't working as well, they're not able to engage with people as successfully as they once were able to, they're not sleeping or they're sleeping too much, they're overeating or undereating, they may be losing weight or gaining significant amounts of weight, and there's usually some feelings of guilt, despair, that can evolve into suicidal thinking. And so typically those symptoms have to be present for more than 2 weeks to classify yourself as major depression, and they can last for weeks, if not months, in rare cases, and sometimes years for really unlucky and treatment-resistant individuals.
What are typically the first lines of treatment? And maybe even not right now, but maybe even go back a ways. How were we treating this major depressive disorder in the past? How far have we come?
Yeah, so I mean, major depression from a treatment standpoint depends on how severe it is. So we talk about mild, moderate, and severe severity. For mild depression, some people find success with just exercise, changing dietary habits, improving their sleep quality, and so they may not require medication. But since basically the 1950s, we've been trying to use medications to treat depression. And so standard treatments now include antidepressants like selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors and some atypical antidepressants. And so that's typically where we would start. If it's more of a seasonal pattern, we might just try like bright light therapy, which we've talked about before, only during the winter months, as that's equally effective as antidepressants are for mild depression. And so we kind of have the gamut of things that we would try if you've been, this is your first or second episode of depression. If you're moving into that third episode of depression, you're probably going to be on lifelong antidepressants, and you may require augmenting medications, and that can be things like lithium or low-dose antipsychotic medications or some of these interventional treatments, which we're talking about today.
When the first treatments don't work, you can give patients other options, and one of those options is TMS, using magnetic pulses to stimulate the brain, and we're seeing video of this right now. How does this work?
Yeah, so TMS basically targets the areas of the brain that are underfunctioning in depression, and we use an MRI strength magnet, which you can see I'm placing on the patient's head here. And what we do is we send small bursts of magnetic stimulation into the brain, and that creates an electrical stimulation that targets the area of the brain that's underfunctioning in depression. And so antidepressants do a similar thing. They kind of increase blood flow or activity in that area. What we're doing with magnetic stimulation is just trying to trigger those neurons to fire more frequently. And so this treatment is pretty effective. It's very minimal side effects, but the trade-off is that it's a daily treatment. So it's 5 times a week for 6 weeks. And so it's a large time commitment. Treatment time is about 20 minutes. Effectiveness is about the same as ketamine. So we're talking about 50% or so of patients will go into remission. About 75 to 80% of patients will at least have a 50% reduction in their symptoms of depression.
Becky, you tried this. What was your experience?
So from a patient perspective, it just kind of like felt like a tapping on my head. And I did it pre-COVID, and I noticed probably about a 50% improvement for a couple months, and then it kind of dwindled after that.
We really want to celebrate this because there are words that you use yourself to describe the status of your depression. What are some of those?
So I think it was about in July when I met with Dr. K. He said that I was in a partial remission, which was just really impressive. Like, I didn't ever think that I'd hear those words. And then overall, like, I still live with depression every day, but Spravato has helped it, like, not take control of my life. And then I just smile and laugh more, and it feels more genuine.
Well, and speaking of your life and the people in your life, which I know are so important to you, have been so much of a support for you, have they noticed a difference? What are they telling you they see in you?
Yeah, so one thing that was pretty cool was we were like going to dinner one night, and my son was like, "Mom, why are you smiling like that?" So it was just kind of cool to see that different aspect. And I've had people tell me that my eyes look brighter and have more joy in them, that I'm not thinking automatically as negatively as I used to, that I'm happier and just have like a spirit of freedom and just kind of all in.
How has it been with your boys? You have twin 10-year-old boys.
Yes.
How has parenting been for you? Have you seen changes in that? We know parenting can be difficult anyway.
Yeah.
How are you doing?
So I feel like with Spravato and like my treatment, I've been able to just be more mindfully present and enjoy each moment with them a lot more, and it's really just improved our relationship.
How's your self-esteem?
It's a lot better. It's still definitely a daily thing that I continue to work on, but my confidence is a little bit better. I have more positive self-talk, and then lately I've just been more proud of myself.
You should be. Last time we spoke, you shared a little bit about your mental health history with us. You've been living with depression for 25 years. You told us that you've hit rock bottom more than once. When you were at rock bottom, how often were you thinking about suicide? What did that feel like?
So when I was at rock bottom, I would say I was thinking of suicide probably up to about 100 times or more per day. And it was just really, it felt so hopeless. So it was nice to have Dr. K kind of just reinforcing, like, there is something that'll work, like, and just kind of moving towards that. And I have had 2 major attempts. One of them I did use the 988 crisis line. And so now that I don't have the thoughts anymore, it's nice to just be able to look forward to my future. Like before, I wasn't able to look past like a minute or 2 and just kind of get through that day to day. And now it's nice to be able to like plan for like years down the road.
We're so glad you're here.
Thank you.
We really are. Be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. You say that you feel proud of yourself for the first time in your life. Tell us why.
So I was working through some of my hard trauma processing with like EMDR and going through my 12-step program and just processing that. So one night I just said out loud like that I was really proud of myself for all the hard work I was doing in my recovery process. And it was just the first time I'd ever said I was proud of myself, and just that I'm willing to do things that I wasn't able to before in my recovery process. That's been a big change.
What do you think is one of those big things that you're able to do that you weren't able to do before? You're taking it so day to day, moment to moment. What can you do now that you weren't doing before?
So I've been able to work through like forgiveness is probably one of the biggest things of both myself and others for trauma that has happened, and just really being able to like take control back of my life.
So if you notice yourself having negative thoughts, how would you handle them?
It's still definitely a daily battle with like having the negative thoughts because I have had this for like 25 years. So it doesn't change overnight, just like it didn't happen overnight. So first I just try and like grant myself a little bit of grace, and so that's even a change in the recovery process because I didn't used to do that like at all with myself, and just really trying to focus on like the positive thoughts and changing it. And it's easy to think of like what's the worst that can happen. That's, you know, the automatic thought that I usually have, but now I just challenge myself to think like what's the best that can happen and realize that it's probably going to be a compromise somewhere in the middle of that.
And you place a huge importance on boundaries. Can you give us maybe an example of some good boundaries we can all learn from?
So I feel like this can kind of apply to anyone that even doesn't have mental health issues, but just being able to prioritize like self-care and realize that it's not selfish as in me first. It's kind of like a me too, like I'm important and have to be able to fill my cup before I can fill anyone else's. And then just really realizing what boundaries I needed for myself for healing was really important as well. For example, just kind of letting go of the shame that was like holding me captive to like my old patterns and everything, and just really developing the trust with like my counselor and Dr. K even more, so that I could like lay all the cards out on the table. I didn't have to feel ashamed for them, and then it just like really led to the treatments that have really been helping me. And then one thing I noticed is especially during the winter, I had to have like in-person appointments versus telehealth. So just kind of realizing that change, I just feel like it kind of makes me more honest, and just like knowing that I need to limit medication access in my home.
You're so in tune to your own needs. I love hearing that. Dr. K, what's it like to just hear Becky and how she's doing today?
Yeah, it's wonderful because I've known Becky for a long time, and so I've seen her through some really difficult moments, and so to see her doing this well just brings a lot of joy to me, and I'm happy that we could get her to a place where she can really enjoy life again.
And Doc, we know this time of year, it's the holidays. It can be a really tricky time because it's very joyful for some and very painful for others. What advice can you give us for people with long-term or just maybe situational depression right now?
Yeah, I mean, the holidays are a rough time for a lot of people, and so some of that's the seasonal changes. And so if you think you have seasonal depression, it might be worth a conversation with your primary care doctor or psychiatrist or psychologist to see if you might benefit from something like bright light therapy in the wintertime. Others, it's just the stress of the holiday season. And then for some people, the holiday letdown after Christmas is over and New Year's is passed and some of those big events have happened, we see people have depression after that. And so some of that is very normal. Like I said, it's kind of that, normative response to difficult times or having a big event and the letdown that comes after it. Some of it can be pathologic. And so if it feels like it's really impacting your functioning, your sleep, your work, your interpersonal relationships at home, or just how you do things around the house, please reach out to your primary care doctor, your psychiatrist, your psychologist. If you don't have any of those, we have, walk-in services across the city at mental health clinics. You can always call our clinic here and we can get you directed to the right place depending on the severity or acuity of the issue. And so there are tons of resources out there in addition to the crisis line that patients can utilize if they feel like it would be necessary or helpful or they're really struggling.
All right, let's get to some questions from our viewers this morning. And Jeremy wants to know, are there any insurance hurdles, or are they pretty good at covering Spravato? Dr. K?
Yeah, there's not really many insurance hurdles as long as the patient has treatment-resistant depression. So typically that's an inadequate response to 2 medications during the current depressive episode, and usually you've had at least 2 episodes of depression in your lifetime. Again, some insurance providers will say it's 3 medications. Some might say that we need to do an augmenting agent instead, in addition to those 2 antidepressant agents. And so it kind of is specific to the policy, but in general, I've had really good success with getting it approved. I can't think of hardly anybody that's been denied outright. Usually we can appeal that and we can talk to a physician on the other end of the line and get that approved.
Alexis has a comment and a question. Comment is to Becky to say how incredible you are.
Thank you.
And that you're helping so many people by sharing your journey. She wishes she could give you a hug. I'll have her give you a hug after the show, actually. And she wants to know, Dr. K, is depression genetic?
Some of it. It's probably about, 10% is probably a rough estimate of patients that are just genetically predisposed. They have some kind of serotonin receptor issue, or they don't make enough serotonin in their brain. The other vast majority of it is what we call, kind of biopsychosocially mediated. So psychological stressors, death in the family, social stressors of some form or fashion that seem to tip people over into depression. Seasonal patterns also probably play a role in that too. And so, yeah, it's not completely purely genetic. There are definitely other factors that mediate depressive response.
Have you seen an increase in depression as technology has become more common with the blue lights and everyone staring at screens? Can that mess with your brain? Are we seeing anything in that area?
Yeah. I don't know that the evidence on the blue light is extremely strong, like the blue light glasses to block all of that. It may be helpful, but I don't think it's conclusive. I think probably the greater detriment that the screens pose are probably to younger kids and teenagers. And again, that's more of that psychological, peer-related, social stressors that can drive depression too. I think adults are more prone to that, but they've probably had a longer period of stability without the screens, and so it may exacerbate some of their symptoms. But as far as like a causative analysis, I think that's yet to be determined, but it's probably more likely to occur in use in general.
Gene says, when you say negative thoughts, he wants to know, does that include negative self-talk?
Yes, absolutely. Yeah.
Not as negative as like more suicidal thoughts, but something is something we probably all do, have negative self-talk.
Right.
So
For example, just like feeling like I'm a failure to myself or my family, and just really focusing on that. And
Jill wants to know how, we talked about that you had been dealing with depression for 25 years, but do you remember the time before that, or even times in that 25 years that you weren't depressed? Did you ever do you remember what it was like not having this type of debilitating depression?
I remember, like as a kid, not really having the depression, but since I was diagnosed with depression when I was like 13, it's been like a common just underlying mood disorder, but I definitely remember happy times, but it's been more so since I started Spravato that I can really hone in on those good times.
Dr. K, so glad to have you with us today. What's the big takeaway from our discussion?
I think the biggest takeaway is that if you are suffering from depression and you have not adequately responded to, antidepressant therapy or psychotherapy at baseline as kind of the first line treatment intervention, just know that there are additional services that can be provided, whether that's transcranial magnetic stimulation or TMS that we talked about today, or Spravato. Those are kind of our 2 major interventions right now. There are additional, medication combinations and other things that can be done, but these are very reasonable next steps if you've tried 2 or 3 medications and your depression is just not getting better. There are definitely things that can be done to alleviate some of those symptoms.
Becky, first, again, another huge, sincere thank you for being willing to share your story, just being so open about it. I know this is the second time you've joined us, and we hope you come back. You really are saving lives, and yours, most importantly, and we're so glad. What do you want people to really take away from your personal story?
Well, first I just kind of want to say thank you for letting me be on the show again, and thank you to my support team and for letting me know the options. I just want to reiterate that your life matters, and to keep working until you find the right combination of medication, counseling, and lifestyle changes that you need. And to be honest with the stigma out there regarding mental health, it can still be really hard, but it is an important conversation, and especially to have with your counselor, your psychiatrist, or whoever you have for your treatment, to just be honest, and also, like Dr. K was saying, knowing what your options are. There are a lot of options from your appointment in the office to in between appointments, because that can feel like a really, really long time sometimes. So it's just knowing what options you have, whether it's a phone call or, hey, I need a sooner appointment, or some places will offer like a direct admission to the hospital, which can kind of take away some of that stigma, as opposed to like going through the ER and already have done something. So just really advocating for yourself to live your best life, and to realize that the journey is really hard, but it's definitely worth it.
Thank you, my friend. Thank you, my friend. You're coming back.
Yes.
You promise you'll come back next year?
I will.
Every year?
Sure.
Okay, it's a deal. It's a deal. All right, thanks to both of our guests today. Thanks to our viewers. We'll see you back here tomorrow. Imagine blood pressure cuffs squeezing your legs, thighs, and hips. Only this is no test, it's a proven treatment for heart health. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Could the same therapy help protect your memory? Meet the physician scientist researching the answer, Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.